everybody. Welcome to another episode of the Healthy Joints, Healthy Lifestyle Show. I'm Dr. Arinola Dada. I help people with autoimmune disease get their immune system back on track, and people with joint pain become pain-free. So today, people have lupus, and as most of my patients know, lupus is an autoimmune disease where the immune system is totally lost its sense and its purpose, and at this point it starts to attack different parts of the body, and lupus is probably one of the most common ones that people know about. And so I wanted to talk a little bit of, if you have the diagnosis of lupus, well, how do you thrive with lupus, right? So we're going to talk today about 5 things that we can do actively and we can implement right now to make sure that we thrive with lupus, right? So one of the most important things is a healthy lifestyle. And in our clinic, we really go into depth talking about the anti-inflammatory diet. We also have a diet when we work with the nurse practitioners, which is really aimed at trying to maximize and optimize the anti-inflammatory properties of diet and how that can help you. So, I think the obvious things are even just avoiding the processed foods, avoiding the foods that are high in sugar, because that does aggravate the inflammatory system, and also avoiding the saturated fats. So it's important, I think, I'm going to assume that everybody knows you're not supposed to be smoking, so don't smoke. If you have lupus, lupus predisposes you to clots, and smoking predisposes you to clots. So definitely if you have lupus, smoking, is going to be a no-no. I'm going to draw the line. I'm going to say no. No to smoking, and avoid excessive alcohol consumption, right? So 1, we said healthy lifestyle, right? And there are things that we can do when we work with you to try to help you to get there, right? 2, take medications as prescribed. And it's a problem, right? Because when you take the medications, you feel better, so you stop taking the medications because they're not helpful. I think there are certainly instances when you stop taking the medication, but I need you to work with your doctor to make that decision. You cannot just stop your medications on your own, right? The reason you're feeling better is probably because of medications and the things that you're doing is helping you get there. But you and your doctor have to stop your medications if necessary, but in a planned and strategic way, not just taking the medications willy-nilly. If you want to stop it, then you talk to your doctor and you have a plan and approach. And so when you're stopping it, it's a weaning down and monitoring labs to make sure that that is the appropriate plan, right? We want to see, if there's a problem, we want to see it when there's a little spark. We don't want to see it when the whole house is on fire, right? So you want to make sure that you're taking the medications as prescribed. If you have a different opinion from your doctor, talk to said doctor. That's their job, right? Your doctor is there to help you on your way to a healthier version of yourself, right? Then 3, you want to keep track of symptoms, right? Because you could have a symptom and you can think, it doesn't matter. Or sometimes, some people have very high pain thresholds. So they promptly forget about unpleasant things, and that's a coping mechanism, right? But those unpleasant things may be things that your body is telling you that things are happening. And so it's best to keep track of these flares and symptoms and things that's happening that you may not even think is important. Like, I think most people would say it's important if they start seeing like blood in their urine. That's a big deal, or if you have a swollen joint and you didn't play soccer last night, right? So keeping track of symptoms, writing them down, discussing with your doctor at the appropriate time I think it's important, okay? And then 4th, when you do have lupus, we're living in the Northwest, we're in the greater Seattle area. So, we don't get a whole lot of sun, but I think we get about 10 weeks of summer and maybe 6 weeks of sun and maybe not that much sun. But when we do have sun, it's important to use a broad-brimmed hat and to also use high SPF, because you want to protect yourself from the sun, because the sun is a known trigger for lupus, right? So that's number 4. And then the 5th thing is to manage stress. I know it's easier said than done, but there are certain things that you can use to cope. And their coping mechanisms, yoga, massage, things that you can do to reduce stress, because stress is a known trigger for attacks. And then a support system, right? And so leaning on the support system, Arthritis Foundation has a support system. people who are going through what you're going through. And sometimes people have things that are helpful, even locally. The Arthritis Foundation also has kind of local programs. We always support Arthritis Foundation. Sometimes Arthritis Foundation they have the Jingle Bells walk, and we have this Halloween themed fundraising arthritis awareness that's done locally in the Northwest area that we participate in, to make sure that we're also supporting our patients. So I'm going to go through again 6 things that will be helpful and help you thrive when you are dealing with lupus, okay? So 1 is healthy lifestyle. 2 is take the medications as prescribed. 3, keep track of symptoms, keep a diary. 4, protect yourself from the sun. 5, manage stress. Massage is not a bad thing. And 6, make sure you have a support system. Sometimes that support system is even your family, right? Having them come with you for your office visits so that they can talk to your doctor too and understand what you're going through and understand how they can support you. So my name is Dr. Arinola Dada. If you are in the greater Seattle area, follow us, see us at overlakearthritis.com. Please share this video if you think it's helpful at all. And yeah, subscribe to our YouTube channel, Healthy Joints, Healthy Lifestyle with Dr. Dada. And yeah, we'll see you in clinic. Take care.